Here the tentorium cerebelli for between the cerebrum and the cerebellum. So generally, itong system na to, with craniosacral therapy, we can move these. So imagine na ganito yung arrangement niya. Di ba? We have here the cerebellum. Dito siya maglalay on the occipital area. So dito banda tong falx cerebelli. Then tentorium cerebelli naman between the cerebrum and the cerebellum. So nakaganyan po siya. So anong principle natin ngayon? First, frontal lift. Kapag frontal lift, we are trying to move. By the way, under the craniosacral therapy, they believe that sutures are movable. But there are some beliefs that sutures are immovable. Okay? So, yun na po yung two difference sa mga beliefs po na meron tayo eh. Okay, so under the craniosacral therapy, sutures are movable. So, according to them. So, here, for the frontal lift, we will try to lift the frontal lobe superiorly. So, what happens is, if we move it superiorly, the falx cerebri and even the falx cerebelli will also move together with the frontal lobe. How about for the parietal lift? For the parietal lift, it is the parietal bone, itong dalawang to, that we are trying to lift. So with the parietal lift naman, we are affecting the tentorium, primarily the tentorium cerebelli, and even the falx cerebri and the falx cerebelli. So yun po yung principles na meron sila. So when we try to move them, we are also moving the craniosacral system of the body. So when we talk about the craniosacral system, it involves the cerebrospinal fluid. So as mentioned nung last time po natin nag-meet, di ba, they consider the CSF flow as the fifth vital sign. So aside from the blood pressure, heart rate, pulse rate, and temperature, for them, yung CSF flow, they consider that the CSF rhythm as the fifth vital sign. So here, we are altering the CSF rhythm para mas makapromote siya ng relaxation. So generally, ano po yung indications natin? Ano po yung indications natin for the frontal lift? So, kasama pa rin po dyan kapag may mga tension headaches. So, yung mga ganong klaseng problems. So, indication po yun. Aside from that, migraines, sinus problems. For occupational therapists, they use this to treat cerebral palsy patients. So, they use this for CP patients. And if you have a decreased smell and taste. Kasi may close relationship po siya dun sa gustatory and olfactory system po natin. So, how do we do this now? Okay, so for the frontal lift. Let's say for example, we have here the subject. So, resting lang po siya. Generally, ganito po yung magiging position natin. Again, the therapist should be relaxed. Then, we lightly place our fingers, the four fingers except for the thumb, over the frontal lobe. So, generally, malapit po tayo sa eyebrows. Medyo nasa temple area din po yung kamay natin. So, my lateral fingers are on the temple area. The fourth and fifth fingers are on the temple area, whereas the second and third fingers are on these areas. So, anong gagawin natin? I will exaggerate first the movement. Parang ganito po yung gusto natin gawin. Superior lift. So, igagalaw po natin yung kamay natin pataas. So, what we're trying to do here is we're trying to mobilize the frontal lobe. Okay, so, first thing that we have to do is to meld with the tissues. So, we are blending with them. We're applying just a very small amount of force. Then if we feel that the tissues are already one with us, then we can start to apply a very, very light superior amount of force. So, yun po yung gagawin natin dito. Patient may still feel signs of release, gaya ng mga naramdaman natin kanina. So, pwede pa rin po maramdaman yun. So, unless those signs of relief are absent, we cannot stop the technique. Paano naman po yung parietal lift? For the parietal lift naman, nandito naman po yung kamay natin. So, for the parietal lift, ano po muna pala yung indications natin dito? Still, we use these for headaches, mga migraines. So, ginagamit pa rin po natin yung parietal lift doon. So, ito po yung picture lang ng parietal lift natin. So, aside from headaches and migraines, ginagamit din po siya kapag may mga general sensory or motor problems. General sensory or motor problems. So, for the parietal lift, what we're trying to do initially is to apply a very light compression muna. So, a very light compression, so it's an inward force. An inward force. Just a very light one. Then after that, if we feel the release, then we will move it superiorly. We will move it up. So, papunta naman dito. So, again, slight inward force, then very light upward force. So the direction is towards me. The direction is towards me. Okay, so sige. Sino po yung gusto mo ng subject?
Di ba may tension?
Anyone po? Sino gusto pong subject?
Sige, si sir na lang ulit. Sige, ako na lang. Sige, ikaw na lang. May tension. Parang wala yun.
Okay, so we will start with the frontal lift. So for the frontal lift, generally, nandito po, pamug lang po ng konti po. Konti pa po. Pamug pa ba tayo? Para medyo relax lang din ako. So I'll just make sure na relax din ako kasi pwede it will take time bago siya ma-release. So, 2 fingers over this area, then the other 2 fingers over this area, temple side. Then, what I will do is I will apply a lift, so a superior force. So I'm starting to blend with the tissues first. Then, I will apply, I'm starting to apply now a very light lift. So the direction is, I'm trying to communicate or to talk to the area so that it follows me. So that we both go towards the direction of the lift.
So, sir, ang force po galing dito? Or...
Yes, actually kasama din yung dalawa sa taas.
4 fingers.
Yes.
Sobrang light lang talaga siya.
Yes, very light siya. Actually, I can feel a little wavy feeling, especially on the right side, which is another sign of relief, a sign of rest. But on the left, it seems medyo stuck siya doon sa area na yun. But now, it's starting to go with me. I can feel a little movement on the left side na. But on the right, it's really moving, as if it's a wave. Parang ganun yung feeling niya. I don't know if mom is feeling something. I don't know. Do you feel anything, mom? So, yun. And medyo I can feel that medyo na-release na rin kasi yung sa left side. Although not the same as with the right side. Then, I can stop na. How about for the parietal lift?
So, ito naman ito. Frontal.
For the parietal lift naman, how sure am I that I am not on the temporal side? Initially, I will ask the patient to clench the teeth muna. If I still feel the temporalis muscle contracting, I am in the wrong position. I have to move more superiorly. So, sige, clench your teeth po muna. May slight contraction pa. Then, dito. Yun, medyo nawawala na. Then, I am sure that at least I am in the parietal area. And another thing, to confirm kung nasa area na ba tayo ng parietal lobe, the last time we did our palpation on the sutures, so we can also do that. So we can palpate for the sutures, or we can ask, for me the easiest way is to check, ask the patient to clench the teeth. If we still feel the muscle, the temporalis muscle contracting, then we are in the wrong area. So for the parietal lift, again, initial movement is inwards. So, slightly inwards, and try to do some compression. So here we are applying the compression, then decompression later on. Actually, I'm feeling some pulsations. Pero hindi siya yung pulsations na maramdaman natin dun sa temple area, di ba? Dahil pwedeng may mga ano dun blood vessels. Actually, I feel the pulsation on my fourth finger. Hindi sa second.
Sa right side.
Sa right.
So yung sampo nagre-rest lang.
Wala lang, relax lang siya. Pwede nakapatong din siya actually. Okay lang.
So, yung pulsation, sir, kailangan din mawala yun?
Yes. Then yun, medyo nawawala na nga po. Medyo nawawala na po siya, so I can start with the lift. Kanina pa-compress ako inwards. Ngayon I'm starting with the superior movement. Sabi nila, bakit daw very light force lang? Because muscles will react. If muscles react, imagine the muscle contracting. It will again cause compression of the sutures. The more that it's hard to move the sutures. So we really need to promote relaxation of the area so that it will be easier for us to move the area. What's the first sign that you need to feel para masimulan nyo na talaga yung movements na to? You will feel that you are already one with the tissues. One with the tissues. So, you blend with them and you're just moving as one unit. So, hindi ako gumagalaw kasi ginalaw ko lang yung fascia niya. Hindi ako gumalaw kasi ginalaw ko lang yung skin niya. So, I'm feeling that we are moving as one unit. Actually, nawala na po yung mga signs ng release. Wala na po yung signs ng yung mga pulsations. Wala na sila. Usually, yung mga techniques na to, pwedeng it will take about a minute up to around 2 to 3 minutes, gano'n. Or maybe more. It will depend on the type of release that the patient has. Then slowly, okay, fair. Pagkataas, then slowly, tinanggal ko yung kamay ko.
Yung frontal, sir.
Parang yung skin lang
Pag
po yung minumove nila.
Parang yun yung feeling. Pero iba yung feeling na skin lang yung gumalaw. Iba din yung feeling na parang sumama din yung things sa loob. So sa therapist, maramdaman mo yung skull pa rin eh. May interaction kayo. So iba yung skin